Hello everybody. DALK is started by marking the 4 cardinal points, then drawing a rectangle at equal distance from the limbus. The center of this rectangle is the anatomical corneal center. This is confirmed by assessing the imprint of the trephine on the cornea. Partial trephination is then done to 70 to 80% of the corneal thickness. This is followed by introducing a bent insulin 27 gauge syringe in the middle mid-stroma. Do not intend very deep introduction of the needle except if you have one of the commercially available blunt air injection cannulas. Air is then slowly injected into the corneal stroma, and you will see the signs of big bubble formation, which is a circular white opacity extending from the center to the periphery, stopping at or before the trephination groove. This is followed by superficial keratectomy, removing the superficial layers of the stroma. Paracentesis is then done to decrease the AC pressure. This can be followed by injection of small bubbles in the AC to confirm the presence of the bubble and to monitor the bubble behavior in further steps of the surgery. Prev/slash is a very critical step where the roof of the bubble is open. The opening should be fast and effective to provide an adequate sized opening. To perform this, a paracentesis should ensure low pressure in the anterior chamber. Then a superplate is placed on the stroma. The stroma is then perforated rapidly by a fast movement into the full stromal thickness with fast release of the plate to avoid touching the descemet membrane with the tip of the plate. The bubble is then re-inflated with cohesive viscoelastic. Before dividing the stroma, a blunt spatula or dissector is introduced in the plane between the predesmatic layer and the stroma to ensure proper dissection till the trephination groove. This step is very important to avoid perforation during cutting the stroma. The spatula should be introduced towards the stromal surface and not on the predesmatic layer to avoid descemet membrane perforation. The stroma is then divided into 4 or 5 quadrants according to the surgeon's preference and the availability of right and left-handed scissors. Scissors should be introduced carefully and avoid entangling the predesmatic layer and descemet membrane in the tip of the lower plate. Cutting should be in snips, with reintroducing the scissors after each cut. Each quadrant is then cut by grasping the quadrant with a toothed forceps, pulling it towards the center, then introducing the scissors, turning the plates of the scissors vertically and pushing against the graft-host junction, followed by closing the plate and cutting the quadrant, thus ensuring a smooth graft-host junction without stromal ledges. Cutting of each quadrant should be also in snips and avoid continuous cuts to avoid entangling descemet membrane in the tip of the scissors. Viscoelastic and debris are then removed by thorough irrigation of the bed. And finally, a descemet membrane-free corneal graft is then placed on the predesmatic layer and sutured by 16 interrupted 10-0 nylon sutures. Thank you for watching the video.